Welcome to Suhail's Paramedical and Nursing Academy. So today, in the previous lecture, I explained about in the previous lectures hemodialysis and peritoneal dialysis. In peritoneal dialysis, there was a small topic. That small topic is called nursing responsibility. Before I am going to say about the nursing responsibility in case of peritoneal dialysis, you have to go and study those who want to join the genetics. Those who are really interested, because these lectures, don't think that I am getting this information I am not telling my own. After the study, after the verification from the different books, then only I am keeping here the content. This content is not my own content I am putting here. Okay, so you have to come first to study. To study the genetics, you have to first come you have to come to see the lecture after studying the cell cycle. So first you have to study the cell cycle in the home, because first lecture I will explain that is cell cycle, that is cell division. In case cell division I will explain the first lecture, that will be the basics I will explain, because in cell cycle I have studied cell cycle for 15 days in my 12th class, in my 12th class. But the thing is, here in 11th 12th we have to study these cell cycle and cell division. But here I will put only one or two lecture about the cell cycle and cell division, in which I will explain the main topics. So after you know the cell division or cell cycle, then only you can proceed for the genetics, the main genetics, because this is the basic. If your basic is weak, then you can't make the building. Remember, whenever you are going to make a building, first think whether the base is strong or not. If your base is not strong, you can't go for construction of the high buildings or large buildings. So the first thing is, in case of nursing responsibility, is that is during the procedure we have to do three things. That will be in peritoneal dialysis, the responsibility will be before peritoneal dialysis, during the peritoneal dialysis, and after peritoneal dialysis. The first nursing responsibility I have explained here, that is in getting informed consent. Getting informed consent means we have to get the consent from the patient or patient's relative. So then only we can proceed for the peritoneal dialysis, because whatever will happen in the future we don't know. Okay, after the procedure we should not be responsible for any kind of complications. So because doctor's role, physician's role, nurse's role is that they will perform their work, but Almighty knows what will happen in the future. No one has the certificate of the life. Okay, so those things we have to get, because this is an invasive procedure. So get informed consent is important. That is the first thing. The second thing, in case of peritoneal dialysis, that is we have to check the vital signs of the patient. Before going to start, we have to check the vital signs of the patient. We have to check the weight of the patient. After checking the vital signs, after checking the weight of the patient, then we have to proceed whether there is not any chance of infection at the site of incision. Whether there is not a chance, whether there is not already any kind of infection, like I told, cellulitis. So you have to be so nurse has to be careful before the procedure. Okay, that is called as, if there is any kind of infection, so we have to be careful. If there is any kind of infection like cellulitis, so then also we have to see the site where we are going to do the incision at the peritoneal cavity. So at the abdominal region we have to do that. And one more thing is there, that I have told here. See, I have written here all the points here. Suppose if there is need of, and sometimes if there is need of care, that is back care. If the patient is bedridden, if the patient is always on the bed, that if there is need of back care, we have to give the basic care, that is baseline, that is back care. And remember one more thing, that is before we are going to perform the peritoneal dialysis, we have to do some assessment, baseline assessment. One of the main baseline assessment is abdominal assessment, because we are going to do the incision, we are going to do the procedure in the peritoneal cavity, so it is related to the abdominal cavity. So we have to go for abdominal assessment. Then only we can know whether there is not any kind of edema in the abdomen, whether there is not any kind of cellulitis infection. These all things we can know only after the assessment. Okay, then we have to amputate the bladder. The patient should amputate bladder before patient is going for the procedure. Before patient is going for the procedure, patient should go for wiring before that. Okay, another is check the lab values. We have to check the lab values, whether there is not any kind of abnormality in the lab values. What are the values? How many nitrogen wastes are there? What is the value of nitrogen wastes? Okay, and then assemble the required equipment, because whenever we are going to do peritoneal dialysis, we have to assemble the equipment. What will be the equipment is there? Suppose there is dialysis fluid will be there, another dialysis fluid will be there, and suppose if there is if it is an automatic peritoneal dialysis, then there will be a machine also there, automatic dialysis, automatic peritoneal dialysis machine. So if it is not automatic, then we have to keep the dialysis solution there, and we have to check the date, everything, whether it is not expired. Then we have to check the volume of the dialysis, how much volume is there. Then we have to connect, and after the procedure is completed, after the incision is done, that means after the procedure is complete, then there will be other responsibilities. But we have to check before we are going to do the procedure. We have to check the time. We have to check the time, how much time we are going to do this, and the date of the dialysis, whether dialysis is not expired. Then after we have to see which dialysis we are taking carefully. We have to see. Then carefully we have to do one more thing, that is IO charting. That IO charting will be done during the procedure. So now we are coming towards the procedure. During the procedure, we have to check the BP, we have to check the pulse after every 50 minutes during the exchange. And after the exchange is complete, after the peritoneal dialysis is complete, we have to check the vital signs after every 1 hour. So during the procedure, after 50 minutes, we have to check the pulse, we have to check the BP, and after the procedure, we have to check every 1 hour. After every 1 hour, we have to check the vital signs, mostly BP, and that is blood pressure and pulse. Another thing, that this was the first point. Another thing is called strict IO charting. I told IO input output chart should be must there. How much volume of fluid the patient is removing out from the body, and how much volume of fluid patient is taking in. That is called an input output chart. So we have to keep the input. This is also most important in case of those patients who are having any kind of kidney disease. Another is need for any kind of bag here. I told if there is any kind of near documentation is important. We have to document what we are going to do. We have to document what is the timing when we have done this procedure, and how much time we have to do this, and then we have to know that in documentation which procedure we are going to do. So all the things whatever we are doing during the procedure, and who was the responsible person for the peritoneal dialysis, that all we have to document. That is called documentation. Another is note color and volume of dialysis. So whenever dialysis drainage, whenever we are going installation of dialysis, then I told you this is called as inflow stage. Then after inflow, there will be a dwelling time in which there will be exchange of nitrogen wastes. After dwelling time, we are going to drain out the nitrogen wastes. So draining out the nitrogen wastes, remember one thing, when we are draining out the nitrogen wastes, we have to know, we should be careful to see the color of the dialysis. So the drainage dialysis that is coming out, we should see the color, because that color will give us whether there is not any kind of bleeding inside the peritoneal cavity, or any other color change is not there. So we can see any kind of abnormality there. Okay, that is, we have to note color and volume of the dialysis. Another is monitor any kind of respiratory distress or abdominal pain. If the patient is suffering from abdominal pain during the procedure, we have to assess that also. Another is after procedure. After procedures, we have to send the blood sample for diagnosis, for the lab values, to check the lab values, to investigate the lab values, and we have to watch for any kind of complication. I told you there are some complications that we have to check. What are the complications that will be during the peritoneal dialysis? So after peritoneal dialysis, there are some complications definitely. One of the main complications is infection. There are chances of infection. There are chances of peritonitis. Okay, infection in the peritoneal cavity. These are the main complications in case of peritoneal dialysis. So there are many other complications also. We have to know these all things we have to do. So before the process, this screenshot I will put also, because I have created another one Instagram account. I have put in Instagram account. I will be putting all the screenshots of the whatever I am explaining here, and you can go to the name is Suhail Ahmed Sheikh. The Instagram account, you can check the account. The Instagram account is separate. That is only for this purpose. That account is called as Suhail's Paramedical Nursing. So in that Instagram account, you can check these screenshots and you can get. First is get informed consent from the patient. get informed consent before we are going to do the procedure. We have to get the informed consent. That means the patient, from the patient we have to get the consent whether this procedure we should do or not. Okay. Then check site for the signs of infection, because first why consent is important, because if anything happen in the future, if anything happen during the procedure or after the procedure, who will be the responsible? So that time the responsibility should not be taken by the person who is doing this dialysis, because life is no one is having the certificate of life. So the thing is we have to get the informed consent. After the informed consent we can do the procedure. Okay. Check sites for the signs of infection, monitor vital signs, perform baseline assessment, then empty the bladder, check lab values, assemble required equipment at the bedside. Then check pulse, BP every 15 minutes during exchange and every hour thereafter. Strict IO charting is important. Need of bacteria, if there is need, documentation is important. Note color and volume of dialysis drainage. Go ahead to note the color and the volume of drainage, the dialysis drainage, monitor respiratory distress and abdominal pain, and after the procedure send blood sample and watch for any kind of complication. Okay, thank you. The next lecture will be coming on the cell cycle and cell division. Thank you. All the best.